Hello, everyone. It's Friday, October the 16th. We've lost 5 people since last Wednesday. Again, it's just 5 too many. It's just all there is to it. We're up to 396 deaths in West Virginia. Our 392nd death is a 94-year-old female from Kanawha County. Our 393rd death, a 65-year-old male from Cabell County. Our 394th death, a 67-year-old female from Mercer County. Our 395th death, a 58-year-old male from Mingo County. Young man. Our 396th death, a 75-year-old male from Fayette County. Not to belabor, don't let these people become a number. Keep them in your thoughts and prayers, please. Over the last 24 hours, we've had an incredible amount of tests that have come in, and our daily positivity rate is at 2.99. That's really way down from where it was the other day. But we did have 498 new positives, cases. Like I said, we had an incredible number, I think in excess of 10,000. But, we now have 4,915 active cases. It's not the worst thing for us to be coming up with additional positives. In fact, in every way that I can look at it, it is the best thing, because every one of these positives that we discover that may be asymptomatic, we are able to do something with it to be able to stop this thing. So the more we test, the more we're going to learn. Naturally, the more positives we're going to discover. And for a while, our total number of infected will go up from the positive side, but what we want to have happen is naturally, it just is common sense to me, that if we can identify the ones that are asymptomatic and absolutely stop the spread, absolutely these numbers will come down. We have 4,915 active cases now, with 14,269 that have recovered. We have 188 people that are hospitalized. Our reproduction number, our RT number now is at 0.99. That's the 9th best in the country, but it's almost back to 1 again, and so we've really got to watch that. We have 1 county in the red, Doddridge. We have 6 counties in orange, that's Morgan, Berkeley, Wirt, Randolph, Mingo, and Logan counties. And you can see from our map, the amount of green has diminished, and now we're basically reflecting outbreaks all over our state. Now, with that, we should all be on guard even more than we are today. Now, keep in mind what's going on all across our country. I think our country now is reflecting right at 60,000 positive tests a day. We are absolutely having outbreaks all across our country, and with that being said, we're going to have them in West Virginia too. We continue to run to the fire. We continue absolutely in every way to try to do all the testing we can possibly do to stop this thing. Just stay the course, West Virginia. We're going to get through this. Our free testing in our orange and our red counties, and our drive-through testing with our new pharmacy partners and all that stuff is all up on our website. Please take advantage of every aspect of the free testing in every way. We now have school outbreaks in 21. We have 21 active outbreaks and 57 confirmed cases in the public schools systems that are being reported by the Department of Ed. They're all up on our website. As of today, we have 43 outbreaks in our long-term care facilities, and we have 12 active outbreaks in our churches, and they are in 11 counties. That's Doddridge, Fayette, Harrison, Logan, Mason, Mercer, Monroe, Nicholas, Putnam, Tucker, Upshur, Wayne, and Wood counties. And I keep going back to the same thing over and over and over. Please listen to me, West Virginians, especially the elderly. You know, if you're going to church, protect yourself in every way, a mask, a pew in between you, social distancing, wash your hands. I mean, come on, West Virginia. Absolutely, we know the churches are a place where we sing, we get together, we love to embrace and everything. Sometimes we're not wearing our mask like we should, and then bad things happen. So really watch, really watch. You know, our corrections now has 8 active COVID cases currently at 5 facilities, and they also have 14 staff members that are active. You know, from the flu vaccine, get your flu shots. This is a very well done program. This is our vaccine plan, and I'm going to read to you just one second. Today, we are submitting our vaccine plan to the CDC for their review and approval. And this has been an incredible collaborative effort by our DHHR, our National Guard, our medical experts, you know, the Office of Minority Affairs, you know, countless others have done really good work. Now you can see by the number of pages and how voluminous this is not just nothing. This is an absolute amazing report and everything. And you know, they have worked on this plan for months, and we are ready when a vaccine becomes available. Once the vaccine is ready, our medical experts will be reviewing the data on its safety. I want to thank everyone that's been involved for all their work and their dedication. And in the midst of this ever-changing and unprecedented pandemic, our team of medical experts has done this great work. You know, Dr. Amjad, Dr. Marsh, Secretary Krause, General Hoarder, and and so many others will be telling you in the days ahead about this, about our vaccine plan and all the different intricacies about that and everything. And you'll hear from some of them today, I'm sure, about that as well. Okay, there's been some additional questions come up or questioning about our CARES Act money. Now, I've been through this 14 times, but I'm going to go through it again, and I'm going to go through it very slowly to make sure that we get it and get it how I see it and get it in a way that's transparent. I mean, for crying out loud, I think we have done this over and over, but we're going to do it again. I want to tell you that without any question, from the day that we got the CARES money, we immediately started to come up with a process that would absolutely bucket monies, appropriate certain monies to where we absolutely could get monies out the door as expeditiously as we possibly could, and we would have monies to be able to prevent things like our business unemployment taxes going off the roof, going through the roof and putting incredible undue burdens on our businesses. Really, with this situation that we have here, it was projected to me that our employers, our businesses could face a multiple of 5 times their current taxation. 5 times. Well, we found a way to prevent 1 dime of that from happening. And we've protected us from our cities and our counties. We have done everything in the world that we could do for our small businesses. We have absolutely protected us with PPE and the additional testing capabilities. We've built medical access roads. We have absolutely slotted dollars aside for broadband. And the major thing of all is we have positioned ourselves to where our businesses would not have to pay one dime more in taxes. Now, through all of that, and I'm going to go through it in just 1 second, I want you to know without doubt, I'm a business guy. I can't help, the accounting process or how things flow through the auditor and everything. But if we look at a number on the auditor's report, and we don't tell the backup part of the story, and we only purposely skew one part of the story, it gives us a very, very skewed and wrong assessment of these dollars. Now, if we could put this slide up, I'll go through it, and I'll go through it real slowly. As far as our small business grants, we slotted $150 million. Now, with all the applications that have been sent in and everything else, we now feel like that number's going to be 40. So now we have changed that slot to 40. For our local governments, we slotted $200 million. We have through today awarded 152 of the 200, and we really feel like that it could slightly be more than 200 by the time we get to December the 30th. From the standpoint of our National Guard and the PPE and the additional testing that we just did probably, a month ago, we have $50 million that's set aside for testing and additional PPE to absolutely assure that our schools are taken care of in the very best manner that they can be taken care of. From the standpoint of broadband, we put $50 million of the CARES money aside to do additional broadband work to be able to help us with telemedicine and to help us with our students in our schools and everything else like that. From the standpoint of our medical access highways, now we've caught a bunch of grief about this, but really and truly, if you're catching grief and you're in an area that you can jump in your car and just cruise right over to a hospital with no sweat whatsoever, there were absolute problems within highways that absolutely we could improve access to our medical facilities and give our residents the ability to be able to get there better if we improve these highways and these road projects. And I think we did some project in every county. Now this is the 800-pound gorilla in the room. Really and truly, from the standpoint of unemployment benefits, our unemployment fund, when we started COVID, and we had people that were laid off everywhere, and we were sending out dollar after dollar after dollar to these people, hundreds of millions, in excess of $1 billion, and as we were sending dollars out, we had an unemployment benefit fund that had $287 million in it when we started. Now, we got one of two choices, West Virginia. If we have the ability, and the federal government clearly gives us the ability to reimburse that fund through our CARES money, not only will it will assure us the insurance policy of the reimbursement of the fund, but it will absolutely prevent, as I have said 14 times, it will prevent us from raising taxes on our businesses and absolutely destroying our businesses even more. So we've got to reimburse the fund. That's $287 million of these CARES dollars. Now, in addition to that, we had to get from, that was prior to That was through June 30th, prior to 7/1. Now, from 7/1 to 12/30, December the 30th, when this all expires, we have to come up with another projection, don't we? We've got to have workforce give us a number. Well, the number they gave us in the beginning was 400 million, and we slotted 400 million. And then we felt like the number was only going to be 350. And so what we did is we took 50 million and we put it into testing and the PPE for the National Guard. And that's for our schools. And so now workforce believes that number from July 1st to the end of December, December the 30th, will be 300 million. We have got to have those dollars to be able to continue to get our federal dollars and everything. We have got to keep those dollars and keep them right where they're at as they continue to move out. We put $10 million in the Fairmont Hospital to preserve and to keep that hospital for the great people of Fairmont. We put $25 million into our public service districts. Now, we reimbursed the state for dollars that they had sent out in the last quarter. I'm sorry, this was the first 2 quarters. Well, no, this is the last quarter of the 2020 year. Now, I know that doesn't make a whole lot of sense, but really and truly, our year end is June the 30th in the state of West Virginia. And so for the last quarter of the 2020 year, which would have been April, May, June of 2020, right in the thrust of the COVID deal. April, May, June, this past April, May, June, we had sent out of state dollars 57 million that we reimbursed ourselves with the CARES money for. From the standpoint of our first quarter and second quarter of this year, which is from July through December, we will need another 96 million of reimbursements on the state monies that we're sending out. And the last thing is we have replenished 25 million into the emergency fund reimbursement. Now, where does that leave us? Where does that leave us? West Virginia, here's the whole deal. We have absolutely prioritized, pledged, obligated these dollars exactly right here. We got $60 million. $60 million of the CARES money of the $1.25 billion, not $900 million. We've got $60 million sitting there. Now just think about it just for a second. What if the cities and counties come in above the 200? What if we have some level of additional outbreak in our schools? We have to have a little buffer there. That's where the business guy is trying to take care of you on every turn. Now, from the standpoint of these dollars, if we had just arbitrarily moved the 287 million over to unemployment, over to workforce, we may have very well lost our abilities with the federal government to give us more optionality with these dollars. The exact same thing is true in different areas and different buckets. These dollars have to stay in place as we go forward and we send them out in order for us to maintain those flexibilities in government. They're pledged. West Virginia, they're pledged. Don't let anybody feed you this junk that there's absolutely this hoarding of this money. I have told you, and I'm going to do it one more time. We got $40 million that we got for our small businesses. We started out with $150 million, but we never had the applications. We got $200 million for our cities and our counties, and absolutely our cities and our counties are taking advantage of this and doing wonderful with these dollars. National Guard has, for our schools, has $50 million of additional testing and PPE equipment that's sitting there, and they're paying bills, and it's going out right every day. Broadband projects, we're about to announce how we're going to spend this $50 million between now and December the 30th, and absolutely upgrade and make broadband even stronger and stronger and stronger, just like the announcement that we came up with just the other day, that is absolutely going to blanket this state with broadband. From our medical access highways, this $50 million will go over to our Department of Highways very, very soon. We have almost finished these highways and everything, and this money will move out immediately. From the standpoint of our unemployment, $287 million and our $300 million, those dollars are kept in the CARES side. We could move them tomorrow over to workforce, but from the standpoint of the prudent thing to do from our federal government side, if we move them, we're going to lose some level of flexibility. They need to stay right there as our security blanket and everything, but those dollars, we have completely drained the fund of the $287 million. Those dollars are completely gone. The only way we can put those monies back is to put that money back in workforce. We'll be able to do that, and without any question, we'll be able to do it without raising your taxes a nickel. Fairmont Hospital's monies are out with the exception of $3 million, and that $3 million, the remaining $3 million will be going out very soon. I don't know exactly where the public service district's monies are and everything, but that money will be going to the PSC, I believe, and they'll be administering those dollars at that spot. From the standpoint of the reimbursement of the 57 in the last quarter of last year, I think that money is gone. From the standpoint of the reimbursement of the first quarter of 2021, which was from July through September the 30th, they're finishing that quarter right now. And when that report is finished, we don't want to do it on a daily basis. That would be crazy, or do it on a monthly basis. We do it on a quarterly basis. And when that quarter is finished, half of this $96 million, or there close to that, that will go out as well. From the standpoint of the emergency fund reimbursement, that's gone. So the net of the whole thing is just this. And if someone can pray tell me a better way, or a more expeditious way, or a better way to look after your dollars in the state of West Virginia, I challenge them in every way. Come and tell us. Because I have had a team of experts, and this is good, rock solid stuff. And if somebody tries to project and say to you, well, you know, Justice is hoarding money or whatever, they're out of their mind. I mean, this is absolutely rock solid as it can be. These dollars are pledged. We've got $60 million, and there's all kinds of things that could very well happen here to eat up that $60 million and eat it up really fast. What I'm just hoping for and hoping and praying that there'll be an additional stimulus package, and we'll be able to do more and more and more goodness to West Virginia. But nevertheless, I hope that clarifies, and I've been through it over and over, but I'm telling you that it is frivolous. Frivolous, that's all there is to it, to just think that there's money unobligated, unpledged, that's just sitting there that's not going to be needed and used between now and December the 30th. You know, what will we do? Let me just ask one question. What would we do? How crazy would you think it could possibly be? What would we do if we had $900 million that was sitting there and we didn't use it? We have to send it back to the federal government. Well, do you honestly think that I have lost my mind? I mean, there's no way on this planet that I'm going to send the money back to the federal government. So you had to have a plan. You had to have an absolute rock-solid plan. That's what we got. That's what we got. But the other flip side of it is just this. What if we would have just come up with the most frivolous spending under the sun? Just come up with an idea. What if we would have, who knows? What if we would have rerouted the Canal River, now, and all the money would be gone right now? Would we be better off by doing something that was that frivolous and that silly? Because at the end of the day, then we would be staring right in our businesses right in the face and saying, your taxes are going up 5 times. What would we do about having the PPE and the testing ability? What would we do to be able to supplement and pay our National Guard? What would we do if we had not come up with a plan and not prioritized it, not pledged it, and not done exactly what we did? I'll take anybody's challenge any day, anywhere, in regard to this. This is rock solid. Okay, last thing I guess I've got is, well, wait a minute. I hope I haven't left some things out. Just one second. Stay with me just a second. Yeah. Say what? Yeah, I have left out 2 or 3 things. Okay. I got kind of worked up about that. Please forgive me. We have sent out $152 million to our cities and our counties. We want to continue to send out money to our cities and our counties. We have an appointment to the Office of Drug Control Policy today, and I am announcing with great pride Dr. Matthew Christensen as our director of the DHHR Office of Drug Control Policy. Dr. Christensen replaces Bob Hansen, and Bob has been with us a long time. He has done incredible work. We're going to miss him and everything. He is retiring effective today. Dr. Christensen, but Bob, we wish you the greatest in your retirement, and God bless you for all you've done for this great state in many, many ways. Dr. Christensen is currently an associate professor at Marshall University School of Medicine. Additionally, he is employed by Valley Health Systems in addiction medicine, as well as the medical director and board president of Ebenezer Medical Outreach, a free clinic in Huntington, West Virginia. So, Dr. Christensen, thank you so much, and we're glad to have you on board. And Bob, God bless you in every way, and thank you again for all your service. Okay, fall colors, unbelievable, are they not? And the trout stocking is beginning. It's going to be a beautiful fall weekend in West Virginia. Our experts tell us that this is one of the best years for fall color in the past decade. I agree. We had a lot of rain in the summer and some cool nights and everything, but the colors are spectacular. Our Office of Tourism releases a fall color map every week, which shows a lot of places in our mountains with tremendous fall color. The map's on your screen. Go to that map, and go see some incredible foliage and the beauty of this state beyond belief. Yesterday, I announced that the fall trout stocking begins this Monday. I've directed the West Virginia Department of Natural Resources to implement additional improvements to its fall stocking program and everything. I want to jump right back real quick and just say this to you. I've been, one time I was really skinny, and I have been a lover of the outdoors in every way. I have spent so much time on trout streams, crawling around on my belly through the rhododendron, with a little 5-foot fly rod, shooting the fly down in the water and fishing in a stream wasn't 3 foot wide, trying to catch a little native brook trout. I have absolutely spent so much time on our trout stocked waters and everything. This state is beyond belief in beauty in every single way. Now, through all those years of doing that and traipsing across all these mountains and everything, all I would say is just go out. just go out and enjoy and take this in, because it will be so good for your soul. Now, with that, there's one thing that we did here a couple years back, and you know, and just to tell it like it is, when a trout stock truck shows up in a spot, you know, it draws a lot of attention. And a lot of our anglers come out and enjoy the day or days after and everything. And a lot of times our fish, because of our manpower, are only being able to be stocked in the bigger pools of water. And so it doesn't really give us trout stocking throughout all the stream. And so therefore, a lot of the fish get caught very, very quickly. And what we want to do is have great fishing every day. And so we implemented, you know, to where we would send crews of people, you know, through either volunteers or whatever, to assist in our trout stockings. And so to be able to spread the fish out. It doesn't sound like much, but it's been very successful. And absolutely, I think our waters today are a whole lot more fun to fish and everything, because we got great people that are doing that. You know, I'll take credit for the idea. I haven't done much of the stocking, but really and truly, the people that are doing it, I know, are making the water so much better to fish. Let me see. On Saturday, I said, you know, our trout stockings will begin on Monday. You know, October the 19th is a special day to me. That's my mom's birthday. I sure miss her. But on October the 24th, the DNR will stock additional trout in lakes at our state parks and our forest. That'll be fun. That'll be really good stuff. So we have so many families and young children getting out and exploring and seeing the wonderful outdoors and all the splendor of West Virginia. It's good stuff. I encourage all of you to get out and do that and be safe in doing so, and just take in West Virginia. It's unbelievable beyond belief. Today, you know, like I said, we're submitting this vaccine plan, and Dr. Marsh and everybody's going to be talking about that, and I think that's all I've got officially now. So again, thank you so much. I hope everybody's a whole lot clearer as far as you know, our CARES money and how it's gone and how we've pledged it and put it in buckets and had to keep certain things in certain places in order to be able to assure us flexibility with the federal government. And I'll promise you to God above, in every way that I can ever tell you, there's no money being hoarded. There's no money that was spent on any pork or pet projects. This was handled the right way, and I am super confident and really proud of that.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I will defer some of the comments on the vaccine to General Hoyer and Dr. Amjad. And I'd like to spend my time with comments just readdressing the issues about community spread of COVID-19 in West Virginia and schools. So we know that we, like other states, as the governor said, are seeing spread of COVID-19 in our state. And what's really important is that as we have designed our map, not for the schools necessarily, but really to document the public health status of each county in West Virginia, I want to remind people of why we're doing it. Talk just for a second about the strategy of the percent positive rate and the infection rate, and then talk about the schools just for a second. So as we are going forward, we know the cornerstones of our ability to stop the spread of COVID-19 in West Virginia is extensive testing. And as the governor pointed out, we had over 11,000 tests yesterday done. Amazing. And we want to be at the 8,000 to 10,000 tests every day, because we pointed out many times but it is the small group of people, the 5 to 9% of people who are infected with COVID, the so-called super spreaders, that are responsible for spreading COVID-19 to 80%, 80% of everybody else. And they are almost always, or at least often, spreading COVID-19 in a period where they don't know they're infected, in the asymptomatic or pre-symptomatic period, which is that 2.5 days to the day of symptoms. That's when they are the most infectious. So in order to identify them and to keep them from unknowingly infecting many other people, then large-scale testing is so important. And part of our strategy for the way that we are doing the public health map, which also is used for the schools, is to be able to identify who those people are by doing extensive testing. And that's why we have the percent positive rate, because the percent positive rate incentivizes each county and each person to get tested. The more you test, the lower that percent value goes, because most people in West Virginia are not infected. But that is so important, as the governor said, because we identify that small group of people who can spread the virus to everybody else. And we're using very strict standards, 5% or less, which is recommended by the Centers for Disease Control, recommended by the World Health Organization, and by the American Federation of Teachers in their initial document. And that is the ceiling. That's the highest threshold that will get you into a gold status as a county. And then if you're less than 4%, you get into a yellow status, and less than 3%, you get into a green status. And by doing that, we have more than doubled the average number of tests that we're doing every day. And we know from work done from Brown University and also our own medical experts, epidemiology people, public health experts, that the risk of people getting infected in a schoolroom is really, really low. Nationally, it's 0.1% of students by confirmed tests are getting infected in a school. And for teachers, less than 0.2%. In West Virginia, it's even less, 0.002%, 0.002% for students, and 0.003% for teachers. 0.02% for students, 0.03% for teachers. And we know that at least to date in West Virginia, we have not been able to identify a clear case of spread inside a classroom. And that's so important. And we know that the spread that comes into schools, the outbreaks, are really brought from the community, brought from people who are getting infected in their houses, in their social gatherings, in other venues, and then brought to the school. And this exchange appears to be more between teachers and staff people, say in meetings or eating, or et cetera, and perhaps students in sports teams and other type of events. And that really is underscored by a study that was done by the Centers for Disease Control that looked at two groups of people that had an equal sort of distribution of age, and they were very similar. One group of people, of about 130 people, had gotten COVID, and the other group didn't. And when the people from the Centers for Disease Control called them and asked them, they both reported wearing masks about 70 to 75% of the time. And so therefore, many people are saying, oh, masks don't matter, people get sick. But if you really read that study, it's really important information. The people that got COVID either had a primary contact, a family member, a close friend, somebody they're around without wearing masks that they were able to identify. Or importantly, if they didn't have that primary contact, these people were more likely to eat in an indoor restaurant or to go to a bar or a coffee shop than the people that did not get infected, where they took their mask off. So we know if people mask up and stay with mask in an environment and stay distanced between each other, it's really, really safe. So it really helps us, I think, feel very confident that in the classroom things are safe. But we know that the spread happens from the community to the classroom, or from the community to other teachers or to people on a sports team, but the exchange is not done inside a classroom. And so we have gained some information from the West Virginia United Caucus, where they're listing all of the outbreaks on a map, which is fine. But the key for us to know is that by controlling the community spread of COVID-19, which means do a lot of tests and wear your mask and stay physically distanced, that we can make those numbers of cases go down even more. Now, if you have somebody who tests positive, who's a teacher or who's a student in a school, then what will happen is immediately you'll get a number of people quarantined as the local health officers, the public health people in the county, try to figure out who really had close contact to those people. And so you're going to see a lot of people quarantined to begin with. And then as that evaluation gets done, then you're going to see those numbers go way down. So we know that we will see some cases in schools, as I said, very, very low exchange and no exchange inside a classroom so far. But we know we'll have some positive people in schools, and we will isolate a group of people that might have been exposed as we do that evaluation. And that really shouldn't be a surprise to us. But we also know that it's so important for so many other reasons, because certain children are exposed to trauma, structure, people that love them, food, and education. And we don't want a whole generation of our students not to be able to get educated. So we are committed to making schools safe, not just for children, but also for teachers and staff. And the way that we do that is we test extensively, which we're doing, which is great, identify those super spreaders. But please, 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 West Virginia, don't forget our power to protect all of us against COVID-19. Wear your mask, stay physically distanced, avoid those 3 C's if you can. Crowds, closed indoor spaces, constant contact, 15 minutes or more from people you don't live with ordinarily. And as long as you wear your mask and do the distancing, then we can continue to control the outbreak of COVID-19 and be the beacon that other states will look to. So thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I'd like to take a point of privilege today and talk about this at a personal level. The governor tries to do an exceptional job of making sure that we read the names and the ages and the counties of the individuals, so he keeps us focused on the human factor on this. But we listen to that, and until it affects us directly, I'm not sure we get the full impact of it. But yesterday evening, my wife and I and the members of the West Virginia National Guard experienced this up close and personal, and it hit us right in the face when we lost a civilian employee of the West Virginia National Guard, Tony Calagrasso, to COVID-19. Tony was an exceptional individual. He was a retired master sergeant from the National Guard who came back to work with us as a civilian employee. He cared deeply about people. He was our TRICARE insurance representative, and on a number of occasions, I can remember families who had young children who had childhood cancer, who insurance challenges were in front of them, and Tony took care of it. And he spent all day and all night doing it. He was a great West Virginian, and on behalf of all the members of the Guard, to Tony's family, we want to send our love and respect. But also, Dr. Amjad later is going to talk about breast cancer awareness. And the unfortunate circumstance with Tony's family is a number of years earlier, Tony lost his wife, Bonnie, to cancer. It was part of the reason he came back to work for us as a civilian, to stay focused and have purpose and take care of his children, his family. So I would ask all of us, I know we think sometimes, it's our right not to wear a mask, or it's our right not to do this. And I ask us to take exception to that and think about our responsibility to others and how we might, with not doing the proper things that Dr. Marsh just talked about, the distancing, the masking, and the things like that, we might knowingly or not knowingly infect somebody. And Tony had all the treatments. He had the drugs, the plasma, and his body just couldn't take this virus. So I would ask all of us, on behalf of Tony and his family, the members of the Guard, to focus, ladies, on breast cancer awareness and getting that testing. For the rest of us all to focus on testing and the preventive measures to keep others from getting COVID-19 whose bodies may not respond to the treatment. We hear a lot about treatments and potential vaccines, but right now we don't have those. So again, I would ask all of us to think about it, because not until you get to it right up in your face at a personal level do you understand the toll that this takes on families. So again, to Tony's family, he was a great West Virginian, a great Guardsman, did a lot of great things for people. And we have you guys in our thoughts and prayers. And I appreciate all West Virginians taking this to heart. Thank you.
Thank you, General. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. Thanks, General Hoyer. Keeping that in mind, it is Breast Cancer Awareness Month, and it's just a reminder that breast cancer is the second leading cause of cancer deaths, only second to lung cancer across the United States and as well as West Virginia. And we recommend breast cancer screening for women over the age of 40. And West Virginia actually has something called Bonnie's Bus that does go around West Virginia. It is for women who do have insurance and who do not have insurance. But I'll post that number on my Twitter feed if anyone wants to call that. But it is Breast Cancer Awareness Month, and we do want to remind women, even though it is COVID pandemic, that is still something to think about. Prevention is key for that. Along with what Governor Justice was mentioning, we have a COVID working group that has been ongoing throughout the summer. This working group has had several medical experts, including the Office of Minority Affairs and several other groups, and that will be going to the CDC today. We're hoping to lead the country with our document to see how the vaccine will be prepared. Several states have been providing this document to see how we're going to have the vaccine plan ready. So that is something that we've been working very hard with. Also, we are aware of a United Caucus website that's been put out there for cases of school personnel and children who have cases out there. This is not accurate data, and I want to remind people to be cautious when they're reading this information. Our health departments work very hard, 7 days a week, 14, 16 hours a day. They work in tangent with the Board of Education, their county superintendents, to provide accurate data for people to be aware of. So I've reviewed this website. We have all reviewed it, but it is not accurate data, and we caution people to look at this very carefully. They're asking for screenshots, audio recording, voicemails, quote, anything that you can have for information on COVID. And this is misleading to the public. We strive to provide accurate information to the public, but the health departments provide cases and contact tracing information, and we are trying to provide accurate information to the public. So I would caution anyone who's looking at this website that it can be duplicated, it can be false information, and our health department, is working very hard for this. But I did want to bring that up because we have been seeing this information. But I'll provide the Bonnie's Bus information. It is, Breast Cancer Awareness Month, and to remind you to talk to your doctor about the flu vaccines, pneumonia vaccine. Prevention is key. Thank you.
All right, thank you, Dr. Amjad. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. I would like to congratulate our team that put together the vaccination plan as well. Caitlin Kahn, who was with CDC for a couple of years, and we were lucky to keep her on a contract basis, led that team, and very pleased. It was an excellent job. It did include a broad range, just so everyone knows, a broad range of groups and individuals on this, including West Virginia University, West Virginia State Medical Association, the Primary Care Association, the National Guard, of course, the Hospital Association, Healthcare Association, Division of Emergency Management, Board of Pharmacy, our local health departments, And we mentioned the Herbert Henderson Office of Minority Affairs. So this was a broad group of individuals, and they came up with an excellent product. So I congratulate them on that and thank them for that. I also want to echo what the governor said about Dr. Christensen coming on board. Welcome. We're thrilled to have you. But I also want to say thank you to Bob Hanson. He really made that office what we had envisioned several years ago, and he has made quite a difference to many individuals in this state. He is an exceptional person. I tell everyone it's easy to be a state employee. It is difficult to be a public servant, and he is a public servant. And we're lucky in DHHR to have quite a few of those. So, Bob, I thank you for your work that you've done here, and please don't fail in retirement. We wish you the best there. Please enjoy it. Let me mention just a minute about the dashboard increases today. That's been discussed a little bit. Today's dashboard included 11,000 tests, and that is the result of changes to individual entities out there who we've been working to get tied into us electronically. We talk a lot about not wanting paper because that's difficult to look at fax information, fax to local health departments, and fax to the state office. We really need those folks tied in electronically. Today, we had the results come in over 24 hours, but we've been working in conjunction with the West Virginia Health Information Network, which is the state's health information exchange, to onboard testing entities performing rapid COVID-19 testing in order to receive those results electronically. In the last week, from October 9th through October 16th, the number of testing entities submitting electronic results increased from 97 to 170. 96% of the labs received today, the specimen collection date was within the past 7 days. So those are numbers that have been in their system, but not in our system. 84% of the labs received today, the specimen collection date was within the last 4 days. So of the facilities that are now testing and reporting electronically, we have MedExpress. All of the MedExpress facilities out there are now reporting electronically. That's 42 facilities. They reported 2,164 tests yesterday. Also, this brings on board the rapid antigen tests, results of 129 probable cases. And that the way we do this with antigen is specific to CDC guidelines. So again, and this also includes Walgreens and other pharmacies coming online electronically. So just want to make sure our folks understand that the additional 4,000 or so tests there are from entities that are now reporting electronically. Thank you.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to ask more about our vaccine plan. So I assume that the first people to get a vaccine once it becomes available will be our doctors, nurses, frontline healthcare people. Do we know, based on this plan, how long it'll be till the average person can go in a Walgreens or a Fruth and get this vaccine? Thank you.
Dr. Marsh or Dr. Amjad, y'all are going to have to take these questions, okay?
Ein, do you want to start?
Sure. Charles, it probably won't be till sometime next year because it is going to take a while. So yes, you're right. The first ones will be the healthcare workers who are working directly with patients. And then it'll be the most vulnerable populations, nursing homes, that type of demographic. So my guess would be sometime next spring, but that would be my guess. Clay?
Yeah, the only thing I would add, Charles, is that, there's a very key requirement for us to not only have the distribution plan, but also go through the appropriate analysis, by the FDA and others of the safety of the vaccines that will come out. So I think what you'll see is there's a number of people that have volunteered to be part of these studies. You'll see the first wave come, as Ein articulated. And I think as the vaccines separate themselves into the ones that will be the safest, best vaccines, you'll see a ramp up of the number of doses available. And depending on when the first doses come out, hopefully in the first quarter of 2021 or so, then you'll see probably by the next quarter, you'll see more people getting vaccinated. And then eventually things will be completely distributed throughout, as you say, the commercial sector as well. So I think you're going to see it come in phases.
Come to me just one second, Jordan. Let me add just a couple of things, and this is bravo to our president and all of his team, Dr. Birx and all them. They, you know, for us in this country to come up with a vaccine in a matter of months, like that it looks like that, not a matter of months from now, but a matter of months from the standpoint of starting from ground zero and bringing a vaccine, you know, into becoming a reality is amazing work from a lot of different people throughout this great country and maybe even the world, you know, that's working on this. But I do caution everyone that this is the flu season, and get your flu shots, because this vaccine, while we were hopeful that, you know, that maybe that it could be here tomorrow, it's not going to be here tomorrow. And I really believe if you want the inside baseball from me, here's what the inside baseball would be. The inside baseball would be, you know, we'll be really, really lucky, you know, if we have that vaccine before the end of the year. And but I do believe that we will have it before the end of February. I think there's a good shot that we'll be vaccinating, you know, our healthcare, our first line defenders and everything, you know, maybe by the end of the year, but surely right after the first of the year. And then I can give you some comfort in just knowing this, that through all the federal people that I'm talking about, from the White House right on down and everything, those people are absolutely have all guns turned on to be able to get our population vaccinated and vaccinated very quickly. So with all that being said, once we're a go, I think we'll move faster than what most people give us credit for.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, it's Kenny Bass with Channel 8 and Fox 11. If the medical folks could weigh in, or maybe the governor could weigh in, whoever's best suited to answer this one. Campbell County's health department yesterday put out a health warning to stay indoors. It was a voluntary quarantine, but stay indoors if you could, because of the spread of COVID and the health concerns of how things are rolling in that county, the direction things are going. And then today we see that Cabell County on the map, if I'm not mistaken, is green. So I'm not questioning the methodology, and you guys can explain that, but understandably that has raised some confusion among people who are now communicating that to us. You know, what's going on here? The local health department is saying all hands on deck, stay inside if you can, bad, code red, and the state map is now saying that Cabell County is green. So if somebody could go through that and allay some of those fears and concerns, I'd appreciate it. Thank you.
Well, first and foremost, you know, we've been discussing all the guidelines and stuff. I think really, if you look at what guidelines the local health departments come out with, you know, we've had those guidelines up, and our legal team, you know, vetted those guidelines, and I think they're really just an echoing of basically what we've been telling people for months and months. But with that, we appreciate your help. You know, we'll take any and everybody's help. I'm not really sure why they did this, but you know, and I want our medical team to comment some more. But with all that being said, you know, I know that, you know, whether it be Bateman or whatever is really, you know, going on there. You know, I had Dr. Amjad go, and you know, I haven't gotten her report back yet, but I feel in my gut there's more of a problem there than what we really know about right at this moment, and I hope to be able to, well, I'll definitely get her report here in just a little while, but with all that being said, you know, we just need to continue to try to help one another and communicate and keep on doing what we're doing, you know, and the situation, but maybe our medical team could report on it more, but the situation in Cabell County is just like the situation in lots and lots of places. It's serious. We absolutely want to give it every bit of our attention and everything, and we appreciate the health department and everything. I'm not sure exactly why, but we're going to keep moving forward. But anyway, Dr. Amjad and Dr. Marsh, if y'all have some additional information.
This bill, Governor, if I could, this Bill Crouch, let me say that there's more to the dashboard than just the map. One of the reasons we include the data beside the map is so that you can look at incident rates separately from positivity rates. And if you look at Cabell, their positivity rate or their incidence rate or infection rate a week ago was 16.16. It's now 20. So I think what Dr. Kilkenny and the folks at Cabell are seeing and are reacting to is an increase in the infection rate there, which is part of the dashboard and part of what you can see. It also shows under the 7-day trend the number of cases. And so they're looking at that, and they're looking at increased cases. So they're being cautious. I would hope that the information on the dashboard has helped guide them in that direction. So we try to be transparent with the data. We try to provide information that gives folks an understanding of the direction of the data and the direction of community spread. So we'll continue to do that and be transparent and then continue to provide more information on there for folks to look at.
Right. And Governor, if I could just say one thing as well, if that's okay.
Sure.
Okay. So I think that the other thing, as Secretary Crouch mentions, which is really, really important, the way our system is working and the whole idea behind it is to make sure it is an incentive system to get more testing and to identify more people, but also it's a kind of a self-correcting system. So as we look at more people tested, and by the same 7-day average, yesterday there was 864 confirmatory tests. And so as we look at the percent positive rate, we can see the more tests that have been done over the last week, we see the percent positive rate start to come down, which is good, which was what we would hope. But we also see that incidence or infection rate goes up, because as we identify more positive people, remember the infection rate doesn't take into account how many tests we're doing, just the number of daily average positive people, we see that infection rate going up. So Dr. Kilkenny is super good, and as our county health officer and the local health department's really good there. And so I think they're being very careful and making recommendations because they are seeing some of these metrics change. But I think what you're seeing as well is by doing more tests, the percent positive rate is going down and the infection rate's going up, as we said it would, because of the way these metrics work. And then over time, as we continue to do the right things in the community, mass distancing, all that, then both of those should come down together, which makes you feel really good that you're controlling the rate of spread truly and more longitudinally in that county. So I think that's another part of what this data will tell us and show us.
All right, thank you, Kenny. Next to Taylor Stuck with the Herald Dispatch.
Hi, everyone. It's Taylor. I know you said that you haven't gotten the report yet on Bateman Hospital, but I did want to ask about it. I got a lot of emails this week, even after I talked about it Wednesday, from employees, people saying that the situation is bad. They're scared. And so I just wanted to see what Dr. Amjad saw when she visited the hospital. Thank you.
Dr. Amjad, maybe you can give us a report on that.
Sure, Taylor. So I went there on Wednesday afternoon and visited So I saw both the regular units and some parts of the COVID unit, and talked to several of the staff and a few of the patients because they are ambulatory around there at this facility. But it's a very large facility. They have close to 400 staff and close to 100 patients there. And the staff is doing the best that they can under the circumstances. I mean, they do have 39 staff positive to date and 24 patients to date. We are going to increase our testing there to at least twice a week for the staff and the residents. And, we can always do better as far as infection control. Our National Guard did go there yesterday to do some sanitation missions, check the airflow, the HVAC systems to see if that's contributing to any infections. Our state lead, Epi, who's Shannon McPhee, also went there to offer some assistance. But they're doing the best that they can. We're going to continue to visit there. I will go again this weekend to see what we need to do. Talk to more of the staff to see what their concerns are. Because if they are continuing to have concerns, especially with that many staff, we need to voice that. But, the staff, the CEO there is doing the best that they can. And we just have to keep addressing and asking more questions. But with a large staff like that, and if those are the concerns, we always continue to ask questions. But the National Guard will also continue to go back and do any sanitation missions and check the airflow. But that's what we'll continue to do.
All right, thank you, Taylor. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. I'm wondering if anyone could shed any light on what's going on in Mingo County. They've had a sharp spike in cases in the past week. They've shut down the schools. They've got their color orange. What's going on in Mingo County and what's being done to help them address it down there?
Maybe Secretary Crouch, can you help us there or with what's going on in Mingo County?
Yes, sir, Governor. We're trying to provide more assistance to Mingo County. I think I mentioned a couple of weeks ago they had some test results that came in faxes and got a little bit behind there in terms of testing entities not being tied in electronically. So we think we've resolved that problem, but they have some community spread in Mingo County that they're, like other counties, trying to get under control. At this point, Mingo has a couple of outbreaks, a school outbreak at Kermit. So again, it's been fairly consistent with regard to the confirmed cases over the past week. But we've got to get to those contacts and make sure that those individuals are isolated and that we hold that spread down.
Have you got anything to add to Mingo County? Is there anything that you'd like to talk about there?
The only other thing about Mingo County I think that is worthy of mentioning is that we've really seen a really encouraging increase in the number of tests that have been done in that county. And we had seen a relatively few number of people show up for some of those testing events. So the broader that we can test and sample the people of Mingo County, and the more we can understand who those folks are that might be able to spread it and control that, that's really important. And we also know that again, that family gatherings, friend gatherings are really common sources of spreading the virus around the country. And we just reinforced to people of Mingo County how critical it is to maintain that very high commitment to wearing masks and physically distancing and the other things that we talk about a lot.
All right, thank you, Mark. Next, we'll go to Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. So for today, I just want to ask, why hasn't the PEIA task force met since January 2019? With everything going on right now, when will it meet again? And as far as long-term funding solution for PEIA, which was promised a few years ago, is there a plan for that yet? And if so, what is it?
Could you repeat the question? I really don't think that this is a COVID question, but anyway, if you could repeat, please.
Why hasn't the PEIA task force met since January of 2019? When will it meet again? And is there a plan right now for long-term funding for PEIA? And if so, what is it?
Well, let me say this, as far as why they haven't met, surely it's in the question that we all probably ought to be taken from on a COVID briefing, but nevertheless, here's what I would say. I would say, we moved to put in $100+ million into PEIA when we had the surpluses back in 19. Now, in addition to that, we know for a fact that through since I walked in the door, I do not think we have had an increase in our PEIA insurance premiums, period. Now, I don't know how it gets any better than that, because I don't know where in this country anybody that has insurance that doesn't have their health insurance go up over the past 4 years, but we haven't. And I think that reserve that we set aside was $105 million. I said 100, I think, but as far as the task force meeting and everything, I'm just going to have to get you some more information on that, because, believe me, as far as PEIA is sound, and absolutely from the standpoint, if it weren't, the insurance premiums would be shooting through the roof, and it is sound. And with what we've had to do in dealing with the COVID situation and all the economics and all the unemployed and everybody else under the sun, maybe that's got shifted back a little bit, but we'll catch up.
All right, thank you. Next to Junate Dill with the AP.
Hi, Governor. Thanks. With this steep incline in new cases, do you anticipate any new measures such as rolling back reopenings or anything like that? And are you considering any more changes now to the color-coded map? Thanks so much.
I would think that the right answer is always this. We will do whatever it takes. I will do whatever it takes. Naturally, nobody wants to shut anything down, and nobody wants us to roll back, because there's consequences on that side too. Everybody that is working with me knows that we're going to continue to do every single thing that we have to do, and knows that this situation is fluid all the time. It is. And from the standpoint of changes on our color map, really, we are achieving now exactly what the perfection up to now has afforded us. And that is just this. We have tested 666,717 tests in the state of West Virginia. It's unbelievable. Unflat believable. Every time we test more and more, we find an asymptomatic person that's able to stop this and maybe very well prevent another death. So, the map right now looks as solid can be. It got a lot better as we changed and everything, and if things dictate, we'll have to revisit there too, will we not? We've got to absolutely know we're dealing with something that there is no playbook. This is a moonshot. We're on our way and landing on the moon, and absolutely, if anybody thinks for 1 second that you can do this without taking the time to step back and change and modify and tweak, you're crazy. Absolutely, this is exactly what we knew we had to do. So we'll just continue to watch. and continue to do whatever it takes to get us through this, and that's what we're going to do.
All right, thank you. And last question today comes from Kelsey Soto with WSAZ.
Good afternoon, Kelsey Soto with WSAZ. We did talk already about Cabell County. Last night they issued a stay-at-home advisory, and then we're still green on the map. I'm hoping we can just get flush this out a little bit more because, on Saturday we're going to get some guidance from the schools and see an update from their weekly map. And, parents are seeing whole classrooms go home and get quarantined. And, we're hearing that schools may not be a big spreading location, but I guess maybe just advice to the community and to parents who are kind of struggling and grappling back and forth with the, I guess the high flux of the ins and outs, the go homes, the quarantine, stay at home advisory, which is deeming only those essential activities. So just maybe some additional guidance and advice for parents and the community over this way.
Well, let me try to answer this as best I can. If you could just imagine, how the people of New York City felt when we were loading people, tens and tens, if not hundreds of people in refrigerator trailers every day that we had lost. This situation swept across the South when we thought we really had it maybe licked. And then it just ripped through Florida and Arizona and Texas, and before you know it, we had colossal problems. In West Virginia, we're no different than others, and absolutely we are going to have trying times. No questions asked. I wish to goodness more than you'll ever know. I pray so much that more than you'll ever know, that I could just tell you, it's going to be fine tomorrow, don't worry about it, everything's all good. I couldn't possibly do that. It wouldn't be right, and it wouldn't be the right thing at all. We are dealing with stuff, and it is tough stuff. I know that it's worrisome. I know it's frustrating. I know it's confusing. I know it's tiring. I know it's all those things. But I can tell you this, that West Virginia has absolutely risen to the top, and it continues to do that. We cannot drop our guard. It's tough stuff. That's all there is to it. And without any question, it's going to continue to probably be frustrating and tiresome and confusing and all those things to parts of our communities for still a good while. Now, that part could be the Cabell County community, or that part could be our whitewater rafting community, or or that next part could be one of our counties that's bordering right near DC. It could be all the way up in our northern panhandle. It could be on our Coalfield expressways. I mean, we are going to have to deal with this. That's all there is to it. It is not going to be easy. There is going to be times when, just like General Hoyer said, it hits home. And it hits us right between our eyes. That's why I say so many days, so often, every time. Just because it hasn't hit you at home doesn't mean that it's fine and dandy to just cruise through Wendy's or whatever it may be, or go to the next ball game or whatever it may be without a care under the sun. Please don't do that. Please, please know that this can hit you, and it is hitting somebody, and it is hitting somebody that is your neighbor that you need to love, and I know you will. And so just please know that there's no point in me apologizing. It is a pandemic. It is something that is swept all across our nation and this world. And absolutely, it is here with us, and it's going to be with us for a goodly little while. Now, we have published all of our guidelines for months and months and months as far as our stay-home orders and all that kind of stuff. And without any question, or safe home orders or whatever they were, but whatever it may be, just continue to watch our guidelines, be smart, don't absolutely get scared, but absolutely be concerned, and we'll get through it.
All right, thank you. Governor, I'll turn it back to you.
Well, the only last thing that I want to do is congratulate Dr. Christensen for being here and being on board now. I'm sure he'll do a fabulous job, and I absolutely want to again thank and congratulate Bob Hanson for all the great work that he did, and I just want to tell everybody out there, just please know this is a bumpy ride, and just know there's still some stormy water in front of us, and for those that are going through really bad water right now, you're not alone. We're with you. Anyway, God bless all of you.